Why do I need a pain-focused peripheral nerve surgeon? You might wonder that, although I suspect some of you are thinking, I'm just wondering what all that means. That was a mouthful, right? What is a pain-focused peripheral nerve surgeon? Well, peripheral nerve surgeons, like myself, are surgeons who have been trained to identify and treat problems relating to the peripheral nerves. What are peripheral nerves? Well, basically, those are any nerves outside of the brain or the spinal cord, okay? So your median nerve in your hand that's responsible for carpal tunnel syndrome, that's a peripheral nerve. Your ulnar nerve here in your elbow that's responsible for cubital tunnel syndrome, that's a peripheral nerve. Your tibial nerve in your foot that's responsible for tarsal tunnel syndrome, that's a peripheral nerve. Your sciatic nerve here in your backside that causes your sciatica, that's a peripheral nerve. There's a small number of peripheral nerve surgeons who are subspecialized in treating specifically pain problems that are arising from the peripheral nerves. The main focus of my practice is treating patients who have pain that nobody else has been able to figure out, largely because that pain is arising from a nerve problem, a peripheral nerve problem. The challenge in patients who have a peripheral nerve problem is that, unfortunately, most physicians are not well trained in the anatomy of the peripheral nervous system. If you know that anatomy, it makes it a lot easier to identify when somebody has a peripheral nerve problem. If you know the nerve, then you know the problem. Not only can that peripheral nerve surgeon identify which nerves are affected, which nerves are causing the pain, but you then have somebody who knows that anatomy, who also focuses, whose primary goal in his practice or her practice is to offer treatments for the pain. There aren't a large number of peripheral nerve surgeons in the United States who focus on treating pain. But if you have a nerve problem that's causing you pain, you may need to see a peripheral nerve surgeon who can focus on that and can offer you well-established treatments that have been shown to be effective in treating your pain. You have pain, we have solutions.